I'm delighted to be here, and thank you all for coming today. It's wonderful to see how this program has grown, how its community has grown, and I think it reflects a recognition that cancer care involves helping people with cancer as well as treating the cancer itself. This wasn't always the case, but I think there's been greater recognition in medicine, in hospitals, in the community, and it largely has come from, I think, the voices of patients and families with cancer who've said that this is an important part of how we manage the disease. I've listened many times to a song by Joni Mitchell called Both Sides Now. Has anyone heard that song? I don't think I ever knew what it meant, actually. But it struck me yesterday that perhaps she knew something about this. Jennifer was talking about emotional wellness, and I would say that emotional wellness in cancer, and people who've had cancer and their families, is hard won. It isn't something that comes easily. It's something that comes from having gone through many things and managed them. And we know that resilience comes from mastering the trauma that come and the hardships that come, and then we gain strength. And sometimes a little help goes a long way. And so I think her words probably resonate. She said, something's gained and something's lost, living every day. And I think that's often for many people have experienced with cancer. Those two pictures, I think, maybe represent the two polarities. We see many people who do achieve a sense of peace, a sense of happiness, and a greater sense of the meaning of life through cancer. But we know that there can also be dark moments, and we're trying to pay attention to those moments and to help people manage them. Jennifer also mentioned that survivorship and all the psychosocial care is part of a larger department that includes palliative care, includes psychosocial oncology, and that is very much integrated with the cancer program. Because probably the most important single thing to maintain emotional wellness is also to maintain physical wellness. We know that people cannot feel well if they have pain, if they have other physical symptoms, so that it's very important for us to try to treat the person as well as to try to treat all of these symptoms. You know, it's a little humbling, and I mean that sincerely, to give a talk like this to a group like this, because I feel many of you could actually tell more than I could about what it's like to go through this and how you've managed, and perhaps in the panels and the discussion, we'll hear more about that. Now, I said to someone, a patient in my office with cancer, you know, about her cancer journey, and she interrupted me and she said, "This is not a journey that I'm going through." I don't know, does anyone like that word or not? No? You don't mind it? Do you have a better word? I haven't found a better word. Experience, yes. I think the reason she didn't like the word, I think, was that I was implying it was some pleasant trip through the fields. And she was saying it's actually a little bit more difficult than that. And these pictures, I think, show somewhat some of the treatments that people go through, the surgery, the chemotherapy, the radiotherapy. And it shows people coming out at the other end, you know, both in this room and also in pictures on the internet. It's not so easy to find men, you know. We notice there is a gender imbalance here. We know that men have cancer as much as women. So we have to think about, where are the men? Is this because the men have emotional wellness figured out, or nobody take that seriously? Or they don't know that they need help with emotional wellness, or that they're not comfortable talking. It is one of the things we try to do in our program, is to find ways to engage men. We know that if we call it an information session, that men are much more liable to come than if we call it a support session, because men need information but not support. But of course, the problems for men are as great as they are for women. Cancer produces many profound changes in the way we feel about ourselves, our bodies, our relationships, our work. Everything in our life is affected by cancer. And it's affected by one's gender, by one's age, by the type of cancer, the type of treatment, but everyone is affected. Now, I noticed that Gene Jackson is going to be leading you in a meditation after this, so I don't know if that's because they thought I was going to make you a little tense, so You might need a little relaxation after this, but I did want to, in talking about emotional wellness, talk about the problems and the challenges people go through. Fear is actually one of the greatest problems. There's a very startling statistic that said that someone did a large epidemiological study in Denmark, 6 million people, and they found that the suicide rate in cancer patients went up 12-fold in the first week after diagnosis, which is a startling statistic. Now, this is not because of physical suffering. These people are at the beginning of that journey, or whatever we want to call it. Pardon me? Challenges, yes. But it's about fear, right? The fear of suffering. For many people in our culture, many of us value being independent people, people who are caregivers, who look after other people. So for many people, the thought that they will now be in a position of having to rely on other people is very frightening. So it's just a reminder that we need to intervene and help people early. There can be a lot of physical symptoms. We once did a study following people with gastrointestinal lung cancer in our oncology clinics, and we found that and Jennifer's done a lot of work on fatigue and other symptoms, but we found these people were suffering from, on average, 6 different physical symptoms. Some of the people had 10 or 12 different physical symptoms. So if you think about a day when you just have one of those, when you just have pain, or you just have nausea or some other symptom, how difficult it must be to manage many of them. So we know that we need careful attention to managing those symptoms. People have different needs from relationships than they did before. There was a program here that Jennifer was leading called Helping Her Heal. We were talking about men before, but it's to teach men about how to help support their partners. Because sometimes one kind of support works fine during ordinary life, but a woman is going through all those very difficult changes with breast cancer or other kinds of cancer, that a different kind of support from their partner is needed. Treatment can be an ordeal. It is like running a marathon, and we need to prepare people. We need to help them manage the side effects. And navigating the health care system is a major challenge. One of the things we do often is help people talk through treatment decisions, right? It's very complicated often to decide what to do. We talk about patient empowerment, but actually, even as a physician, I would find it very difficult, in fact, to decide in many circumstances. The information is so complex that it's a complicated matter to obtain information and to make a decision that fits best with your own needs. And so we need to help people navigate the health system, helping people return to life, which is a major goal of this program. Having gone through this treatment, now to return to one's daily life, to work, to family, to all the other things that gave people satisfaction. And sometimes people have to live with fear of recurrence or progression of the disease. Even in cancers with a good prognosis, that fear often lingers because, of course, it's a fact of human life that all of us have to live with uncertainty in our future. Having cancer perhaps reminds us of that. Now, so much of cancer and so much of our teaching is focused on individuals. But we know it's actually a family problem. They are I suppose what's below the tip of the iceberg is the children, the spouses of cancer patients. And it's an interesting thing. In other countries, this is much more taken for granted. As you may know, in some countries in the East, they talk to the family rather than the patient about the cancer. And many clinics, the whole family comes into the clinic or into the hospital room. But whether the family are there or not, they're profoundly affected. And we have to do more to try to help the spouses, the children, and the extended family of those people with cancer. So just to tell you something of the experience that you may know very well, but we've been doing a study in people with acute leukemia. Acute leukemia is a condition in which you can be cured from it, although there is often a high risk also associated with it. But what's unique about it is that you might be in your doctor's office on Friday and feeling okay and have the results of a blood test and be in the hospital on Monday. So it's a very dramatic change in one's life circumstance, facing intensive treatment and all kinds of risk. Human beings adjust better when they have time. Adjusting to things on a dime is very quickly, and this patient describes it. This can suck you into a vortex. All the blood tests, and suddenly you've got this Hickman line, and the next thing you know, you're getting treatment. It's just like whoosh, your life is literally not your own. And this person described it as being abducted by illness. And this is often the experience when we get bad news, when there's a sudden change in our status. We need to find a way to intervene quickly in a timely way and to prepare people for this. There are many treatment effects from cancer, some of which we help here. We know that there can be effects on memory and concentration as a result of chemotherapy and other treatment, radiotherapy as well. This is something that wasn't known for a long time. I think women with breast cancer were complaining about this, and it really was thought to be just a kind of worry rather than an actual problem. We now know that it does occur. It's not specific to breast cancer. It actually occurs as a result with chemotherapy and other treatments of all cancers. And Laurie Bernstein over there runs a cognitive rehabilitation clinic. She's done a lot of research studying this problem, demonstrating the impairment that may occur and helping patients find ways to manage it. Lymphedema, you see the swollen hands is another common side effect. These are just a few. There's many of the treatment effects, and fatigue is one of the most common symptoms. And this often, as you may know, goes on for a long time. It's something that employers don't always recognize, families don't always recognize because it's not visible. But it can be highly distressing. And I think one of the goals of the Cancer Rehabilitation and Survivorship Program is to help people during treatment and subsequently to manage and actually possibly prevent some of this fatigue. So, I mean, why am I talking about these physical effects? Because these have such an effect on emotional wellness. That the idea that your emotions and your body are separate is really an odd idea. And sometimes there can be distress even when the treatment was successful. This patient said, the surgery was successful. My doctor was very pleased with how everything went. I thought for a moment I could move on from my cancer and all the fear, but now I'm back feeling sad and heartbroken. I think I've gone through too much heartbreak and pain this past year and a half. I don't really feel anything now but an overall sense of sadness. So here's a patient who had a successful treatment, surgery which was extremely successful with an excellent result. She has an excellent prognosis. But it was only after the treatment that the magnitude of what had happened had hit her and the impact that it had on all of her relationships, including, this is a young woman, including her boyfriend who found it too much, a young man who found it too much, and the relationship did not survive the treatment. And uncertainty. This is not this patient's picture, but it's a picture of another patient. The good news is that I'm engaged to be married. The bad news is that my cancer has come back. And this is a problem that many patients have to live with, is how do you live your life in the presence of a disease? Now, this becomes an increasingly common problem as we grow older, that a cancer is much more often a chronic illness, we understand, than before. And living with illness and how to live well with illness is something that we know can happen, and our survivorship program is dedicated to. But for young people, it's out of the frame of ordinary expectation, so that it's shocking, it's distressing. And in studies we've done with young adults, they talk about how isolating it feels as their peers go on with their lives. They've been preoccupied with cancer and its treatment and feeling cut off from their peers. So what can we do to help? Well, it turns out human beings are remarkably adaptive. There is two people surfing in the face of those waves, and I think most of us are impressed with the strength and the resilience that patients and their families bring to the experience of cancer. People find strength that they didn't know they had. You know, when we present statistics, one could look at these statistics sort of two ways. Often when we look at how many people have significant anxiety, how many people have significant depression, we find that it might be somewhere between 15 to 20% of people at any one time are significantly anxious or depressed. We want to do everything we can to help that substantial minority, but that means that 80% of people are actually managing. And so I would say that human resourcefulness, human capacity for adaptation is probably our biggest strength. And all of you probably know that. I suspect any of you that have faced cancer, I suspect have found strengths in yourself and in your family that you may never have known existed. But, you know, it struck me that we haven't, we need another word, but we haven't prepared people adequately in the past. Cancer is a predictable problem. You know, we know what treatment effects are liable to occur. We know the decisions that need to be made. We know the effect on family. We know the duration of time people are going to require to adjust. But we haven't prepared people adequately in the past, particularly in terms of the psychosocial resources. You know, it's always struck me that if someone were to go mountain climbing on a very high mountain, you would never just set out one day and climb the mountain. You would understand what's involved in mountain climbing, and you would have the proper shoes and the proper clothes and oxygen if it was needed and the proper food and nutrition. You wouldn't simply go climbing the mountain. And yet in the past, that's sort of what we expected people to do, to each person to figure out how to climb that mountain of chemotherapy, radiotherapy, surgery. So we need to provide people with information early. We need to provide them with practical assistance. How do I get even to the cancer center? Where do I go when I get into the cancer center? You know, what do I do when I get this side effect? Who do I call when I have pain? How do I manage my financial problems? All of these things will affect emotional wellness of the patient. We need to figure out how to ensure long-term, sort of longitudinal relationships with healthcare providers. I'd be interested in what your thoughts are, but I think we've done better cross-sectionally. Cancer Care Ontario may know about this, than longitudinally, that people say that my doctor's excellent, my nurses are excellent, but people often go from doctor to a different doctor when they receive chemotherapy or radiotherapy or surgery, and they may cross the street when they're at the Toronto General Hospital here or at Princess Margaret Hospital, and we haven't done enough to help people navigate that system and to have continuity of the healthcare providers that they see. We need to provide emotional support. We have far more resources here and in our cancer hospital than we ever have before. But it's actually probably a fraction of what we need. The most important support will come from family, from peers, from support groups. But we need teams of people to help people face the anxieties, the fears, the distress, and the family disruption that occurs with cancer. These things aren't yet, I'll preach while I'm here, these things aren't adequately funded. That funding, as you may know, has gone to chemotherapy, to radiotherapy based on those costs. Typically, supportive care has not been included as part of that package. It's most often been an afterthought. This is something that's been corrected, but more and more patients and experts in cancer are realizing that this is just as essential a part of cancer care as is the best medical treatments. It's actually the least expensive form of cancer care. This kind of care does not require operating rooms, does not require radiotherapy machines, and yet we've economized probably the greatest on it. So to help people pay greater attention to the clinics, we've actually, that iPad is an example, we've introduced electronic distress screening. This is now becoming a standard of care in cancer settings. We know that clinics are busy. Doctors don't have time, as much time, and nurses to spend with people as they would like. This touchscreen allows people to fill out on a screen their symptoms of anxiety, of depression, their physical symptoms, their practical problems. There's a printout. It goes to the electronic record, and the doctor can then focus on those patients who have particular distress. That's what it looks like. Some of you may have seen that. Have some of you seen it? Yeah. Now, we want to make sure that people, the team responds to those symptoms. We don't only want people to fill it out. We want to make sure that there is a response, and we've now established an algorithm. Dr. Madeline Lee in our department has worked with Cancer Center, and this is now increasingly being introduced. She was just talking at the Sloan Kettering this weekend, who are interested in introducing this tool. We've introduced volunteers into the clinics. That's one of the ways that we've responded to the problem in staffing, and sometimes because of their availability, volunteers can often be extremely helpful. And that's Darren Modell, who's the social work manager in the middle, who trains and supports these volunteers. So emotional support is much more powerful than we would think. It's as powerful a tool as any we have. Lots of cancer patients, however, I don't know if any of you have had that experience, have not always found the supportive comments from other people helpful. Has anyone had that experience? So it's an interesting question why that is. Now, we know we haven't trained doctors until recently in how to communicate with patients. We know that we've assumed that doctors know how to do that. We train them for everything else. Doctors are trained in all the technical procedures, but I received no training when I was a medical student in communication. And so now we understand that this is something that can be taught, and we have evidence that skills improved. So it's teaching empathy. Now, empathy, this is one definition, the capacity to think and feel oneself into the inner life of another person and to care about that person. So it's putting yourself in the shoes of another person. Now, it actually develops quite early. Even very small children have the capacity to feel with another children. There's some very alarming statistics which show that when you look at medical students over time, and when you look at residents over time, they actually get worse. Their empathy goes down. And I think because we overload them, we burn them out, and we don't provide support and training and processing of emotional experience. So we have to help people do better about that. Does anyone know the difference between empathy and sympathy? Yeah. So sympathy has to do with expressing your feelings toward the other person, right? I feel sorry for you. It has nothing to do with your feelings, and it has nothing to do with whether you're wanting to know about those feelings of mine. And so, but that's commonly what people do, is they express feelings of sorrow for the other person rather than try to put themselves in the shoes of another person. So empathic communication has to do with understanding the patient's perspective. And one of the things we're training physicians to do is, even in brief interactions, it's possible to spend some time understanding the experience of the patient and helping the patient feel known and understood. So there's many things that are done here that you're going to hear about today. There's many paths to emotional wellness, treating the physical side effects. We know physical rehabilitation and physical exercise is one of the most powerful tools that affects not only physical well-being, but also emotional well-being. And there's a whole variety of other wellness programs. There's all kinds of electronic information and support that's available. Do you know that, for example, at the University Health Network, patients are now going to be able to see their whole electronic health record? Do you know that? This is an interesting thing. It could be a mixed blessing. You have to be careful of what you want. In fact, I came across someone's now constructed a measure. It's the information overload measure, which will be interesting to see what the results show, that patients often are overwhelmed with facts and information, and will now have access to their own health information, which may be hard to interpret. On the other hand, it's very hard to make informed choices without proper information. So people need guidance and help with how to interpret and make use of information. Okay, I'm just going to talk in the last few minutes about some tailored approaches that we've developed. Cancer isn't one thing. You know, if you're a woman with breast cancer, if you're a man with prostate cancer, if you're someone with lung cancer, all these brain cancer, all these diseases have different side effects. They affect different parts of your body. The implications for survival are different, and we don't think one size fits all, and we need more and more to have tailored approaches around these tumor sites and for the specific problems. This is one approach that we developed for people living with cancer. These are people who've had more serious cancers, and we call this managing cancer and living meaningfully, and we gave it the acronym CALM. And this was the idea that managing cancer involves two things: all the practical problems that you have about how do you manage your treatment, how do you manage your symptoms, how do you talk to your doctors, how do you talk to your family, but also it involves all of the profound sort of what we could call existential questions. What is the meaning of my life? Am I living my life in the way that I want to? Are my relationships the kind that I want? And I think one of the challenges for people living with cancer is having to face both of these very practical questions as well as these very profound questions. So this is delivered in 6 sessions, which, you know, in the field of psychotherapy, of psychological treatment, is very brief. You know, in the field of cancer, of course, it's extraordinarily long. It's not a resource we've had at all. But we've got funding to do a large randomized controlled trial here, funded by the Canadian Institute of Health Research, and there's another one we've got funded through German Cancer Aid in Germany. So we're trying to generate evidence to show this could be helpful, and it addresses these 4 main domains, which we think are the 4 domains that people often need to address. One, as I keep mentioning, is symptom management and talking with the healthcare providers. Secondly is all the changes in self-concept and changes in relationships. Thirdly is a sense of meaning. And finally is one's hopes and fears about the future. And actually, we've shown so far our results. We don't have the results of our large RCT, but all of our results show that a relatively brief intervention actually makes people feel more whole as a person, results in less depression and less distress about the future. We hope this kind of evidence will change cancer care. And one of the important ingredients of it is under what Jennifer called talking, it's reflective space. Cancer care, everything happens quickly. People have brief appointments with many healthcare providers, and there's often not time to unpack. What does my disease mean? What does this treatment decision mean? And so one of the simple things we're provided in this intervention and that you're providing in the survivorship program is a chance for people to talk and reflect. And that's what people said. They said it gave a safe place to process the experience, assist us to manage the illness and navigating the healthcare systems, to resolve the disruption in their relationships, and to be seen as a whole person within the healthcare system. Coming together helps us understand that these are not unique problems. Sometimes people think they're the only ones that are facing these problems. They're shared problems, and we found when we were developing this intervention that we thought it was a good idea here in Toronto, but actually we're now training people in various parts of the world, and I mentioned China, and of course they're finding it very useful, because they haven't had a way to get help and support for how to talk to each other and for how to talk to patients about these problems. So that's maybe just a glimpse of some approaches to emotional wellness, to distress that may occur, to how to deal with distress. And I think the day throughout, I think, will be leading you through a whole variety of multimodal approaches on how to deal with emotional wellness. So thank you very much.